treatment methods. An uncommon and extensive condition by the name of lymphedema is sweeping across the nation. With lymphedema becoming more prevalent, it is important that we are informed as well as able to recognize and manage it before it becomes an immense problem. Lymphedema is severely undiagnosed due to the lack of knowledge in the field. You or someone you know could possibly be suffering as a result. As someone who personally suffers from lymphedema, I will be able to relay my own experience and knowledge. Tactile Medical, a lymphedema treatment company, reports that more than 5 million Americans have lymphedema. To put that into perspective, that's the entire population of Iowa and Nebraska combined. In order to begin to comprehend this condition, we will understand the basics of it, figure out the treatment methods for it, as well as explore the field of lymphedema therapy and its technological advancements. What is lymphedema? In Zuther, Armour, and Norton's 2012 book titled Lymphedema Management, the Comprehensive Guide for Practitioners, the definition is provided saying, lymphedema results in abnormal accumulation of water and proteins, principally in the subcutaneous tissues. The lymphatic system is shown in the green dots and veins throughout the body. Once your lymphatic system no longer works, you're unable to get rid of fluid in the body, which results in a buildup and swelling. According to Wood's 2007 book titled Lymphedema Care, she discusses the two types of lymphedema, primary lymphedema and secondary lymphedema. Primary lymphedema is from gene abnormalities. You're born with it, you either have an insufficient or compromised lymphatic system. Secondary lymphedema comes from external factors, such as infection, cancer and treatment, trauma, and obesity. Obesity in connection to lymphedema prevalence is huge because obesity can profoundly change your lymphatic function. It increases the chance of developing lymphedema. Research provided by Meharar and Green in the article named Lymphedema and Obesity, Is There a Link?, uncovers the connection stating, recent studies have shown the extreme obesity can result in markedly impaired lymphatic function in primary lymphedema. In a 2014 article titled, The Vast Majority of American Adults Are Overweight or Obese, and Weight is a Growing Problem Among U.S. Children, written by Murray, Nigg, and McDodd, provide the shocking statistics that 2.1 billion people today, nearly 1/3 of the world's population, are obese, which highly impacts how much lymphedema can arise. Next, we have the stages of lymphedema are introduced and broken down by Borman's 2018 article, Lymphedema Diagnosis, Treatment, Follow-up from the Viewpoint of Physical Medicine and Rehabilitation Specialists, and the Turkish Journal of Physical Medicine and Rehabilitation. As you can see, stage 0, there's little swelling. This is the reversible stage. Stage 1 is where swelling is more apparent. It can still be reversed. However, when we get to stage 2 and stage 3, it becomes uncontrollable and you are now stuck with lymphedema for the rest of your life. And the only thing you can do is manage it. So the treatment and management methods. The biggest one is complete decongestive therapy. This has several therapies underneath of it, but we'll focus on the main two being manual lymph drainage and compression therapy. Manual lymph drainage is done by a lymphedema therapist. They do a type of therapy where they're able to move the fluid out of your body. However, this is really hard for patients to do on their own, so usually they don't do it. Next is compression therapy. It keeps swelling down and improves the venous and lymphatic return. Here are examples. I myself use knee-high compression socks to help with the lymphatic fluid removal. Next, we have lymphedema therapy and technological advancements. The two biggest are tactile medical and surgical advancements. Tactile Medical has created a lymphedema pump, the pneumatic compression pump, as shown in the picture. What it does is it puts air through the tubes into the cavities and it blows up and compresses the body so that it's able to move fluid out. It's a lot easier than manual lymph drainage. And then there's also the surgical advancements, lymphatic venous anastomosis. This advancement in surgery is discussed by Carrion, Cruz, Tain, and Soren's article titled Lymphedema, From Diagnosis to Treatment in the Turkish Journal of Surgery. This technique involves the creation of connections between the lymphatic system and the venous system in the distal or proximal extremity. What this means is they're going in and they're taking your lymph system and they're connecting it to your veins in order to help move fluid throughout the body better. However, this is an extremely hard surgery to complete, so sometimes it does not work for all patients. Based on the information provided, the rarely heard of condition by the name of lymphedema is more prevalent than many realized. Now you are able to recognize how common this condition is. Many people have it, yet it goes unnoticed. In this presentation, we covered the basics of lymphedema, discuss the treatment methods for it, as well as exploring the field of lymphedema therapy and its technological advancements. To close, I would like to leave you with a quote from Roxon's 2017 scholarly article titled Lymphatic Medicine, Paradoxically and Unnecessarily Ignored. It is disheartening to learn that the average American medical school graduate receives an exposure to the lymphatic curriculum for less than 30 minutes within a 4-year medical education. This degree of medical neglect and ignorance should be unacceptable to all of us. Thank you.